So hand surgery basically has two separate parts to it, I would say. It can involve emergency surgery or what's called elective or non-emergency surgery. For the emergency side, we're mainly dealing with traumatic injuries, cuts to the tendons, nerves, or bones. And then for the elective side or non-emergency, you've got conditions like nerve compression, for example, carpal tunnel, bony problems like osteoarthritis, which can involve doing joint replacements. And then you have other conditions like Dupuytren's disease, which can involve taking out diseased tissue from the hand to improve function. When is hand surgery required? It's usually when there's been an injury or the patients are finding there's pain or loss of function. So for example, if you have osteoarthritis, you may have pain in a joint, and that is stopping you from being able to go about your daily tasks. And then, we might start off with a steroid injection, or ultimately it may progress, say, to joint replacement surgery. The other area where hand surgery can be required is after an injury. So for example, if you cut a tendon, doing DIY, or if you break a bone in the hand, then hand surgery is used to fix those damaged structures. Are there any alternatives to treat serious hand injuries? Well, there's always different ways of treating various injuries. So part of being a hand surgeon involves looking at each specific injury and then coming up with the best possible way of treating it. So if you're looking at a broken bone, for example, there's various different ways we could treat that, either from non-operative and using splinting and physiotherapy, through to using wiring techniques or plates. Our job is to think what's going to be the best in terms of long-term function for the patient. So the main risks of hand surgery, I'd say, are injuries to structures nearby, for example, nerves. If you injure or irritate a nerve, that can lead to pain or altered sensation called paresthesia. You can sometimes get weakness as well. Hand surgery can also result in stiffness due to scarring around tendons, and that's where the physiotherapist comes in to help people get back their full range of movement. It can also be quite sore in the initial days and weeks after hand surgery, and patients will be given painkillers. And like with any operation, there's small risks of problems with bleeding or infection, and sometimes we give antibiotics as well. So the recovery time for hand surgery operations is different, really, depending on what operation you've had done. Sometimes we'll put the patient in a splint to rest the hand. Sometimes we'll ask to get the patient moving straight away to try and maximize movement. Usually the hand has settled down in about 6 to 8 weeks to be able to perform most tasks. But often to get the full range back and for everything to settle down, that can take anything up to sort of 6 months or so. So it does vary depending on what you've had done.